Hello, darling. It is wonderful to be here with you. We are jumping off the PCOS Fertility Health Podcast for 2024. Today, you are going to learn if and how to know if your fertility doctor is right for your PCOS. Okay? Hi, I'm Dr. Angela Potter. I am the host here at the PCOS Fertility Health Podcast, and I'm super excited to be here with you. Before we jump into today's episode, do you have your free ticket for the PCOS Fertility Masterclass that I'm running? You can grab your ticket over at drangelapotter.com. Just go to the main website, and at the very top, there's the bar to click, and it'll take you to the Eventbrite to get your free ticket. Okay. Do you have that yet? If not, jump on over there. I will also link it in the show notes. If you are struggling to get pregnant with PCOS, you do not want to miss this masterclass. I've run it before. It's been super popular. And you're going to learn these top 3 misconceptions that are out there that are keeping you from getting pregnant. You're going to learn that information, and then you're going to learn what you need to do next in order to help optimize your health in order to get the best chance at making a baby. Okay. So today, let's talk about how do you know if your fertility doctor is right for your PCOS? And you might be wondering, well, I haven't even thought about this, or how do I know? What in the world? This is why it's so important, is because not all doctors practice in the same way. Okay. Yes, there's treatment protocols. Yes, there's algorithms for, how to treat certain conditions and what's coming up, what medications are needed. But there is so much more to being a doctor and sitting in a doctor's office or being with a doctor and getting the care that you need. With PCOS in particular, there are many doctors out there who are just giving dismissive information, right? Maybe they just completely dismiss your symptoms, or, they just say, oh, you need a fertility medication and we're going to jump you off that, or just lose weight and everything will work out. Or, yeah, you just need to get back on birth control pills. There's a lot of this going around. And if you have experienced this kind of dismissive information, my heart goes out to you, and I'm so sorry. So, we're going to talk about that, what to look out for with your doctor. Are they really supporting this holistic fertility picture for you, which is super important for PCOS? And here's the thing, you might need 2 different doctors to work with in order to get the best fertility plan forward. And here's what I mean by that. So you might need a fertility doctor, somebody who orders medications for you and does an IUI if that's a part of your fertility picture. That doctor might not be the same one as the person who is going to help you optimize your health, regulate your hormones, get your egg quality optimized, all these different facets of this, beautiful fertility holistic picture for you. Those 2 doctors can be different people, okay? All the time, I'm working with women around the country. And, when I'm working with women who aren't close to me, I'm helping them with this optimization of their health. And then they have a local doctor, of course, that they are working with who can run those or order those medications for them and do an IUI if that's necessary. And so it can be this beautiful, togetherness community of people surrounding you to optimize your fertility. What I don't want for you is your only fertility doctor to be somebody who is giving you that kind of advice like, oh, honey, just lose weight and everything will open up for you. No. Or if, you're going in for your first fertility visit and they are saying, okay, you've been struggling for the last year to get pregnant. And so here is letrozole for you. You're going to do timed intercourse this cycle. No, put the brakes on that. Okay. Now, fertility medications aren't bad. The issue with fertility medications is that they're being used in the wrong part of the fertility journey. Okay. All right. So let's talk about, how to know if the doctor that you're working with is the right one for you. So, number one is that they aren't going to jump to an ovulation induction medication at your very first visit. Okay. You want this doctor to be able to order your lab tests, or if you have a history of a lot of labs very recently, if they're able to interpret those lab results from an optimal fertility perspective. Okay. So, labs are kind of at the baseline, just this really nice, concrete stack of information that you can move forward with to optimize your fertility. Okay. So you want a doctor that can look at your lab results, can tell you which ones you need in order to see this comprehensive view of your hormones. So, number one, like if your doctor is running your thyroid health, are they running more than just your TSH? Your TSH is your main thyroid hormone. It's, I'll say, the most common lab ordered for thyroid health, but it does not give you a full picture, not even in the slightest. And so, does your doctor know about this global view of hormones that needs to be looked at? Are they willing to order that for you? And then, can they interpret that from a fertility perspective? So, continuing to talk about that TSH, that main thyroid hormone number, if you're just getting a lab back, normal on a reference range for the lab is typically between 1 and 8. It might vary by lab to lab, but I've seen that pretty commonly, 1 to 8. For fertility, you need it between 1 and 2. Some fertility doctors will let you go to 2.5, but that is a very narrow range compared to the standard reference range for a lab when you're just looking at general health. Okay. So, is your doctor ordering you comprehensive labs, and can they interpret those from an optimal fertility perspective? You want a doctor who is able to talk to you about nutrition. Okay. Not everyone with PCOS has insulin resistance, but nutrition is an incredibly powerful part of fertility to help balance blood sugar levels in order to improve fertility, improve ovulation, improve egg quality, getting in antioxidants and good fiber to help with hormone regulation, egg quality. These need to be at the foundation of your fertility plan. So yes, doctors often nutrition is not in their scope, and that's okay. As a doctor myself, a functional medicine practitioner, we did have a little bit more nutrition experience in school, but even before becoming a doctor, I studied nutrition. That was my undergrad degree, and I was a nutritionist and a chef for a few years. And so that's a big part of how I practice, is to support women understanding how food supports their fertility and their PCOS and their hormones. It's okay if that particular doctor you're working with doesn't have that kind of a background or isn't able to provide those resources for you. But can they connect you with somebody who can? Does that doctor know the importance of nutrition, and can they say, oh, here I've got this a dietitian to refer you to, this nutritionist, like this meal plan system that's really nutrient dense and isn't about just a fad diet. Okay. Do they have those kinds of resources? And are they willing to have those conversations with you about the importance of nutrition? Okay. And more than just saying, oh, just go lose weight. Or if you get less than X amount of pounds, your fertility will open up, right? That is not a conversation about nutrition. Sometimes supporting weight loss does need to be talked about in the fertility journey, but it doesn't need to be the focus of nutrition. Not at all. There is so much more to nourishing your body with foods than just talking about weight. Okay. All right. Is your doctor talking to you about egg quality? Have they shared with you the importance of egg quality? Do they know how to help you improve your egg quality? And if you're working with the kind of doctor who says, oh, we're not going to talk about egg quality because you're born with the egg quality that you'll ever have, that's a big red flag. And they just have things mixed up in their minds about eggs. And here's why. What's true about what we as women are born with is the number of eggs that we are born with. Okay. The number of eggs that we are born with is there. Okay. You can't really grow more eggs as you get older. All right. What happens is that with every cycle, every period, every time that you're ovulating, is that a certain number of eggs, a few thousand actually, it's quite incredible, are getting ready to ovulate, are trying to mature so that they can be like, yeah, I'm the one who gets to ovulate. And then, you typically just one gets to that mature state to ovulate. That is what we're talking about with egg quality. Egg quality doesn't have to do with the number of your eggs. It has to do with how well your eggs are developing and can one get to that mature place so that it can ovulate, head on out to go hang out with the sperm. Okay. You can absolutely change your egg quality. Okay. The eggs that you have today are not going to be the same as the eggs 3 months from now. Okay. If you are doing these changes to support your egg quality, because the quality of your eggs is based on the environment that they're in, the amount of antioxidants and nutrients that they have in order to develop. And we're changing that on a daily basis. What kind of nutrients we're exposed to, how we're overcoming certain deficiencies and supporting hormone balance. I mean, that's a day-to-day process. And so if you're really hyper focused on those nutrients and antioxidants that the eggs need, then heck yes, your eggs 3 months from now can be very different from the eggs that are right now. But lots of doctors get the egg quality confused with egg reserve. And so if you're somebody who's talking with a doctor who is saying, well, you can't do anything because you're born with that, they're talking about egg reserve. And it's like, okay, I need to go find somebody who will really help me with egg quality. And then you want to be working with a doctor who is able to really get to the root cause of your hormone imbalances, of your ovulation issues, of this PCOS picture that's keeping you from getting pregnant. Now, the few areas that I see that I work with the most are going to be things like gut health, other hormones like cortisol and thyroid, how those are interacting with your reproductive hormones, and then also your toxic load. Okay, so if you're thinking about your digestion and fertility don't usually go together. They're not really top of mind, all right? Toxic load, sometimes people think, yeah, that makes sense. Cortisol and fertility, not usually a top of mind topic to think, well, what would my cortisol have to do with my fertility? A lot. Okay. So you need a doctor who is able to globally understand what these different hormones and systems of the body, how they are interacting on your reproductive tract. Okay. Cortisol, our stress hormone, can raise insulin levels and shut down ovulation. Okay. It can lower progesterone levels. And so you need to be at the forefront of understanding how these things are affecting your reproduction, because you might be someone who gets bloated and has a piece of cheese, and all of a sudden you're running to the bathroom and no one's talking to you about that, and all they're doing is handing you a fertility medication, and you've been trying it for 5 rounds now and it's not worked, but they haven't been supporting your gut health. let alone, helping balance your hormones and improve egg quality and that kind of foundational stuff. Right. But do you see how you really need to have somebody who is willing to have these conversations with you, who is willing to do that investigative work into your picture to understand what's going on so that then you can treat those things, right? Get a fertility plan that looks at how to overcome those deficiencies or those imbalances to help you have the best fertile juiciness in your body. So I want you to think about this. Last time you met with your fertility doctor or the past few times, have you had these conversations? Or go make an appointment with them and start instigating these conversations. Ask them about nutrition, talk to them about egg quality, hear what their response is, and that will give you a really clear indication if they're who you need to be moving forward with. And, I want to remind you that when you choose to work with a doctor, you don't have to stay with them. Okay. If they don't fit with the type of care that you are looking for, you can absolutely go find another doctor. Okay. You're not stuck with them. And also, you don't have to work with just one. As I was mentioning at the beginning, right? You can have somebody on board for the procedures you need or the medications you need ordered. And you can be working with another doctor who really understands this more holistic picture of what your health looks like. Okay. So, I want you to take a few minutes after you stop listening to this episode and just really give a think to, are you getting the level of care that feels right for your body? Do you have a doctor who is able to help you find the root cause of your issues, to do that deep dive into your health picture so that you have this clear idea of what's affecting your fertility and then a plan to move forward to help treat that so you've got this amazing chance at getting pregnant? So, thanks so much for being here today. I really hope that you got some clear ideas of the kind of support that you need from a doctor in order to help open up your fertility. If you want to support this podcast, please head on over to Apple Podcasts or Spotify and give me a positive review. It's super helpful, and it's helpful for other people to be able to find this information. You are amazing, and I believe in your ability to turn around your fertility journey and have the best chance at getting pregnant with PCOS. I'll see you next week.